Okay, we are going to be doing kind of the third portion of our med administration. So we've already checked our MAR, verified it to the doctor's orders. We've been to the med room. We've done our 2 checks in the med room. And now we're coming to the patient's room. So we're going to knock. Good morning. My name is Jan Bucks-Kemper. I'm a registered nurse. And I'm going to be giving you some medications this morning. So before we get started, let me get my hands washed here. And I'm going to pull up your chart, okay? And can you tell me your name and date of birth? Brad Smith, 4/24/1957. I've got Brad Smith, 4/24/1957. And I'm going to put the cursor there. And Mr. Smith, are you allergic to anything? So I scan the armband, okay? Codeine, okay, and it says codeine, and I have codeine. What does codeine do to you? Okay, all right, well, we're not going to be giving you any codeine today, but I'm going to go ahead and raise the bed up to a good working height. And I'm going to go ahead and do my third check on my medications, and then once I do my third check on my medications, let me just look at that real quick. Okay, and then I will explain all of them. We'll do our assessment and get all of that done, okay? All right. All right, so for third check, I've got Smith Brad, date of birth 4/24/1957. I have NPH insulin 5 units, subcutaneous AC. I'm going to be giving the 9 o'clock dose. So I've got my NPH insulin, it's U100 NPH insulin. Expiration date was 5/2026, and so that is correct. And in my syringe, I have NPH insulin 5 units. It's sub-Q, it's the 9 o'clock dose, and I've got my initials there, okay? So, and I want to make sure that I still have 5 units, which I do, okay? And so I'm going to put that right there, and I'm going to go ahead and scan my medication, okay? And so I've got that one done. I've got Smith. Let me get my next one out. Okay, so I have Smith Brad, date of birth 4/24/1957, and I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. I'm going to be giving the 9 o'clock dose. So in my hand, I have digoxin. It's 0.25 milligrams, and I'm supposed to give 0.125 milligrams. So I'm going to need to, I need to cut this in half. It's able to score. And when I cut it in half, I'm going to give 1 half tablet, and that will give me my dose of 0.125 milligrams PO. And so I'll take the pulse before I score that, okay? So I'm going to go ahead and okay, and I'm not going to score that until I take the pulse on that. But I've got my scorer right here in case for us to do that. Because I don't want, if it's less than 60, we don't want to waste our medication. Okay, so then we have, excuse me, Smith Brad, date was 4/24/1957. I have Rosefin 1 gram, reconstitute with 2.1 mil, 1% lidocaine for a final solution of 350 milligrams per mil. Give 350 milligrams of final solution, IM, BID. I'm giving the 9 o'clock dose. So I have Rosefin 1 gram, reconstitute with the 2.1 mils, 1% lidocaine for a final solution of 350 milligrams per mil. And so it's 2.1 mils is 1% lidocaine for a final solution of 350 milligrams per mil. And so then I have my lidocaine 1%. The expiration date is good, and the expiration date, we'd already checked all of those on that. So my lidocaine, and I took 2.1. mixed it with my Rosefin to give me my final dosage of 350 milligrams per mil. So I'm going to give 350 milligrams. So in my syringe, I have Rosefin 1 gram mixed with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per mil. So my dose is 350 milligrams per mil, and I have 1 mil, and it's IM. I'm giving the 9 o'clock dose and my initials. So I need to scan. Sometimes they won't scan, so okay, and I need to scan. That one, because it's rotated on there, didn't scan as well, so I'm going to go ahead and put that on there. So I've done my third check and scanned as I go along. Okay, and then I have Smith Brad, date of birth 4/24/1957. I have Tobramycin eye drops, 1 drop in left eye daily. This is going to be my 9 o'clock dose. And I have Tobramycin, optic drops, optic means eye drops. Date of birth, expiration 1/2028, and so the container is intact. And again, I'm going to be giving 1 drop in the left eye, okay? So now that I have done my third check and scanned, and I've scanned my patient's armband. All right, Mr. Smith, we're going to start giving you your medications. And so the first one I'm going to talk about is your NPH insulin. This is for your diabetes, and so it's to control your blood sugar. Your blood sugar, we checked it this morning, and it was good. It was in the normal range, which that's where we want it to be. But with your insulin, with your diabetes, you know, it causes you to have high blood pressure or high blood sugar. And so with that, you know, signs and symptoms we want to watch for: excessive thirst, excessive hunger, excessive urination. Sometimes it can decrease your appetite, but if you kind of start feeling like irritable, those are things that causes the high blood sugar. Now, when we give you your insulin, this is an intermediate acting. The NPH, it's going to help maintain your blood sugar at a normal level, but sometimes it might cause it to go low. So hypoglycemia would be, so you started kind of feeling irritable, if you start feeling a little anxiety, maybe some numbness, tingling, restlessness. We're going to teach your family about if you start kind of getting some confusion. But with all of that, we want to make sure that if you need to get out of bed, you call us, okay, before you get out of bed, because we'll come help you to do that, okay? We don't want you to fall or anything like that. And so with that, we're going to go ahead and talk about the different sites. So we can give in the arms, and so we're going to find the acromion process, go down to the elbow. Anywhere in that back side on both arms, we can give that. Now we've got some privacy here. And we can give it in the abdomen. So we're going to find your belly button. We're going to mark it in half. And of course, we're going to stay away from that dressing. But we're going to stay 2 inches away. And anywhere in these quadrants, we can give your insulin. And then the other place we can give it is in the top part. So we've got a hand above the knee, right at the groin, and anywhere on this anterior portion that we can give subcutaneously. We'll give that medication. And then once we give this insulin, we've got to make sure within 30 minutes that you've eaten something. So I've made sure that the breakfast tray is out in the hallway. So as soon as we get your meds done, I'll get your breakfast tray in here, okay? Any questions on that? So do you give this at home? All right, you probably give it in your abdomen and your legs. So we're going to work on your arms. Do you know where you got it last? In your right arm? Okay, so we're going to give it into your left arm, okay? All right, so then the other thing is we've got your digoxin. And with dig, it's an antiarrhythmic. And so the things we want to watch for is if you start having any nausea and vomiting, or the big thing is if you start having any visual, like green or yellow halos or vision, you need to let us know immediately. Sometimes it can make your heart rate be a little irregular. And a thing before we give this is we've got to make sure that we do an apical pulse. So again, we've provided for privacy. And we'll teach you how to do your pulse. Let me get my stuff cleaned here. And so we've got our privacy. So we're going to need to do an apical pulse because the order says that if your pulse has to be above 60 in order to us to give this. Okay, so we're going to go to the second intercostal, third, fourth, fifth. We're going to go mid-clavicular. And we're going to listen for a full minute. Okay, it's been a full minute and I got 80, so we will document that in our chart, so that means we can go ahead and give that, okay? And so there's some other things that we'll, during our assessment, we'll be watching for, but those are some things we want to watch for. I'm also going to be giving you your tobramycin eye drop, just one in your left eye, and so we will be assessing your eye, we'll be cleaning it. If you have any kind of irritation or it gets more red or some rash around it, then we're going to need to, we'll let the doctor know about that, okay? But this is an anti-infective. And then the last one we're going to give is we're going to give your, it's Rocephin and lidocaine. This is another, the Rocephin is another anti-inflammatory or anti-infective. And then the lidocaine is, it helps with pain control, giving it, and so this is going to be IM. And with this one, we're going to assess the signs and symptoms of infection in the wound for what we're giving this for. But we're going to watch for any kind of rashes, any kind of changes in your bowel, maybe if you start having any kind of growth in your mouth, it's called thrush. We need to make sure we know that, okay? So sometimes it's kind of give you diarrhea, so we'll be checking your bowels and how those are doing. But any kind of major rashes or irritation, itching or anything like that, you need to let us know, okay? So for IM, we can give it in the arm, in the deltoid. So we're going to find the chromium process, put 3 fingers, we're going to do upside down triangle, and we can give that no more than 1 ml, but typically this is for vaccinations, okay? Then the other place is going to be in your thigh, the ventral gluteal, okay? So I'm going to put a hand above the knee, one at the groin. My thumbs are going to be on the lateral side of your leg here. And then I'm going to draw imaginary lines, so anywhere in this muscle, the vastus lateralis, okay? The other one is the ventral gluteal. And so I'm going to get you to kind of roll over and bend your knee. That way it kind of relaxes this muscle. And so this is the left, your left hip. So I'm going to use my right hand, and I'm going to put my hand on the greater trochanter in my palm. Okay, it's kind of a little difficult to do that here. But my left hand on the palm on the greater trochanter, my thumb is going to be pointed towards the groin. Then I'm going to put my index finger on the anterior iliac crest. I'm gonna spread my fingers and in this area right here, okay? So find the anterior iliac crest, the greater trochanter, my palm, my right, this is my left, so my right hand would be there. It'd be facing this way. My thumb would go to my groin, my index finger to the anterior iliac crest, and then I would spread my fingers and it would be back there in the ventral gluteal, okay? And you had it in the right, so we're gonna give it in the left today. Okay, any questions about any of those? All right, so since we've done that, I'm gonna go ahead, normally we would do the least invasive to most invasive, but I'm gonna go ahead and give you your Rocephin and lidocaine injection because I need you kind of laying down, and then I'm gonna do the other ones while you're sitting up. So we're going to use do our IM injection first, and so I want to make sure I still have 1 ml, and I've got this is my Rocephin in the lidocaine, okay, because I've got 2 syringes, making sure I've put a 22 gauge 1 inch to make sure I could get down into the muscle. And so with this, we're going to use the Z-track method, okay. So I'm going to pull the skin to the side. I'm going to clean from the inside out, okay? Making sure I don't go back over where I just cleaned, okay? Let that drop. And going in a 90-degree angle, 1, 2, 3. I'm going to support. I'm going to go ahead and give slowly. And then if you have any irritation around that, I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come straight out. I'm going to deploy my safety, and I'm going to go straight to the sharps. I'm going to assess the area. We're going to do a glove to glove, skin to skin, and I'm going to do a medical hand wash. Okay, so we're going to go ahead and sit you up. Okay, are you good there? Okay, I'm going to go ahead and give you your insulin. Now, like I said, the breakfast tray is outside, so we need to make sure you're eating something within 30 minutes. And we're going to rotate in your arms since you give it in your abdomen and your legs at home. Okay, so we've assessed the site, found our site. And I've got my MPH insulin, and I still have my 5 units in there, okay? Sub-Q can be either 45 or 90 degree. With insulin, they want you to do it at a 90-degree angle, so I'm gonna go ahead and pinch an inch. I'm gonna clean from inside out. I'm gonna make sure I don't reach over the area I just got through. And at a 90-degree angle, 1, 2, 3, I'm going to go ahead and give that 5 insulin. This one has, this is deploy the safety device. And we're going to make sure we're not rubbing or anything. So glove to glove, skin to skin. Do another medical hand wash. And then we're going to go ahead and okay, I'm going to go ahead and give you your, since your pulse was 80 and it's above 60, so we can go ahead and give this. And so this is your digoxin. So I've got my cutter, it's got the razor blade in there. I've made sure I've cleaned it because we're not sure who had used it before and whether they cleaned it or not, so we've cleaned all of that. I'm going to take my peel out because we've already scanned all of our medications, did our third check scan, okay? Okay, so I'm going to line the line that it has with my razor blade, so it's going straight with the razor blade, and then I'm going to go ahead and I'm going to break that. Okay, so I'm going to put half of it in there. I'm going to take the other half and I'm going to put it in the sharps container. Okay. And so with us breaking that in half, that's going to give me the 0.125 milligrams, which is the correct dose. Okay? Have you had any problem swallowing? No? Okay, so take me a little swallow. Okay? Take your medicine. Here's another drink. Okay? Did you get that down okay? Can you open your mouth and let me look? Lift your tongue up. Sometimes your mouth gets dry. It's kind of hard to swallow that, but you got that down okay? Okay, good. All right, and I'm going to clean this up so it's ready for the next person to use. And I'm going to do glove to glove, skin to skin, do a medical hand wash. All right, the last thing we're going to give you is your eye drops. Okay, and I'm going to go ahead and just kind of put your head, the pillow down below your head here so you can kind of extend your neck back a little bit, okay? And we're going to be looking at your eye and assessing the eye itself. We're going to assess the conjunctiva when we pull down to the inside of your eyelid to see the redness. We're going to see if there's any drainage or anything. So I'm going to take a warm wash rag and I'm going to clean from the inside of the eye out. And take another section of my washcloth, again clean from the inside to the out, okay? Making sure we get any little crusties, checking for those, and I would put that in the linen hamper. Then I'm going to get a tissue, and I've got my tobramycin. We're just going to be doing one drop. So I'm going to take the lid off, and I'm going to support my hand on your forehead, and I'm going to gently pull down your lower eyelid so I can see the conjunctiva there. And so what I want you to do is I want you to look up, because I don't want to drop this on your eyeball. I want it to go into the lower conjunctival sac there. Okay, so look up, okay, and I'm going to put one drop, okay, and then I'm going to put some pressure on the nasal lacrimal duct for 30 to 60 seconds. Now, one of the things that you've got to be careful of, if you're going to be doing this at home, you also don't want to make sure you touch the tip of this to the eyelashes, because the eyelashes have a lot of bacterium on them, and then that could contaminate the tip of this. So I took it off, did the one drop, and then I'm going to put my lid back on. And I'm going to put the pressure, we're going to put pressure for 60 seconds, 30 to 60 seconds, because we want to keep this medication in the local, in the eye area. We don't want it to become systemic, okay, throughout the rest of the body. Okay, so it's been 1 minute, okay? Plenty tears or anything up like that. Are you doing okay? Okay, so glove to glove, skin to skin. I'm going to do my medical hand wash. Alright, so you doing okay? Not any problems so far? Okay, like I said, we're going to get that breakfast tray to you here in just a little bit. So I'm going to put your bed in the lowest position. Side rails are up ×2, wheels are locked, your call light's within reach. I'm going to leave your head of the bed up because you took that medication for at least 30 minutes, but because you're going to get your breakfast here in just a little bit, okay? And so once we've given everything, I'm going to come over here and I'm going to document. So I need to document where I gave my insulin. So did that in the left upper arm. And then I'm going to put my JB. Okay. Down here underneath my dig. Now, when we scanned it, it said it was an overdose. So in the hospital, it'll actually have you can go in there and say that you gave a half a tablet of that. So I'm going to go ahead and put the half a tablet. Oops. Gotta spell it right. Half a tablet, and I need to put that the apical pulse was 80, okay, because that shows that we did our assessment beforehand. And then we're going to do my JB, because that means I gave the medications, okay. For the Rocephin, we gave it in the left ventral gluteal, and I gave my JB. That's why because the patient may not be able to tell the next nurse where they gave it, so they know where that it was given, okay? And then in the tobramycin, I don't have to put anything in this because I gave it in the patient's left eye, and I gave 1 drop. So all I have to do is just initial that I gave that medication, okay? So we did our assessment, then I'm going to come down here, and I need to put J. Bucks-Kemper, my credentials, and then I need to put my JB, so that anybody, if the patient had any problems, they can come back and say, okay, well, JB gave that, who's JB? JB is J. Bucks-Kemper, okay? So that means I have signed my MAR, and I've documented everything for my MAR, so I'm going to go ahead and close my chart out, okay? And make sure, now are you comfortable? Is there anything that I can get for you? No? Okay, so we're going to be bringing that breakfast tray here in just a little bit. And because we've given you that insulin, we need to do 30 to 60 minutes to get that in here. So is there anything else that I can get you before I leave? Okay, well, if you do, just put your call light on, and we'll be back in here with your breakfast tray. And then call to get up if you need to go to the bathroom or anything, okay? And so I'm going to go ahead and leave the room.